Yeah, and you can start, sir. Proceed. Please proceed.
Okay. Okay, is my screen visible now?
Yeah, it's visible. It's visible.
Okay, okay.
Yeah.
So welcome everybody to Kaun Banega Champion Part 2. We have all the teams here. We have got 4 teams here. We have gone through the rules and instruction, and we are briefly doing the naming ceremony, and we are going to do a toss. So let's quickly start. So we have got 4 teams. We are going to, Prashant, you are ready to lift the sheet and we can do the naming ceremony?
Yes.
Okay. So first we have got Premature Panthers. So just let us know that pick up the sheet and who is going to be called Premature Panthers.
Just a minute. It's Surat.
Surat. So Surat team, kindly please change your name and rename yourself to Premature Panthers.
Okay, sir.
Okay.
Thank you. Next we have got Meconium Masters. So who is going to be Meconium Masters?
It's Rajkot.
Rajkot. So Rajkot team, kindly change your name to Meconium Masters, please. Next one we have got Hyperbil Heroes.
Ahmedabad.
Ahmedabad. So please change your name. And the next one is, fourth one is a Precious Preemies. Precious Preemies, they are going to be
Karamsad.
so,
Karamsad, no?
Karamsad, yeah, sir. Right. Okay. So just for audience, there are going to be 5 rounds. First two rounds will be MCQ based rounds, and 3 and 4 rounds there are no MCQs. They have to speak the answers. And in last round there is a rapid fire round. So I am going to start. Sorry.
Yeah.
Hello.
No, sorry. Please go ahead.
Yes. So we are going to start.
Nothing. Please go ahead.
This is going to be first round. I'll just quickly pose a demo question so that people know what is going on. What do you mean by neonate? The question is to Premature Panthers. This is their first question. So this is a demo question, so don't worry. Just you have to speak the number. Okay, tell me.
4.
Okay. So when I pose the question, I will click the button and you will get the 15 seconds for each question. Since you said 4, I will say it's a correct answer. So Dr. Krunal will score 10 points for this question.
Okay,
Okay, sir.
Is that clear to all the teams? Or any question with that?
Yes, sir. Yes, sir.
Yeah. So in round 3 and 4, there are no options. You will have to speak the answer, and we will decide whether it is right and whether to score for that or not. And depending upon that, we will go ahead. So this for first 2 rounds, there are 10 points for each correct answer, and there are 2 questions in each round. So we have a sequence. First, yeah.
All the teams, both the people are not very clearly visible on the video. So if they can sit closer or whatever in some way.
You made it clear, sir, that they have to sit closer and they have to make themselves visible.
तो काफी ये Meconium Masters में आधे
Please, candidates, participants, kindly sit together so we must see you. Then and then the validity will be there.
Keep the mobile phone a little bit far away so both can be seen then. Mobile phone or laptop, if you can push it slightly further, then both can be seen. Meconium Masters, अभी भी दोनों थोड़ा आगे रखना. Or you can shift slightly behind.
Yeah, they need to be together, definitely.
Okay, I think that's okay. We can see parts of it. Yeah.
Great, thank you, sir. So we'll fire away with the first round. Best of luck to all the teams. The round will start. We will start with Premature Panthers. Okay, you will get 2 questions in succession. First question, 15 seconds, you will have to answer. Second question, 15, and then after the other team will come.
Okay, sir.
Which of the following is not seen in the echo of a baby with PPHN? Tricuspid regurgitation, bowing of septum towards right, reduced myocardial contraction, and bidirectional shunt in PDA.
Sir, 4.
That's a wrong answer. Okay, you can't score. The right answer is number 2. Bowing of septum is towards the left, not right. Okay. So we are going to go for the second question. So Dr. Kronal, they won't get points for this. Yeah. Number 2 question, same team, Premature Panthers. You are ready?
Yes, sir.
Which of the following is not a part of quadruple test in pregnancy? PA, alpha fetoprotein, inhibin A, and unconjugated estradiol. Time starts now.
प्रोटीन है, पापा है, unconjugated. So 3.
I'm sorry, unfortunately, this is also wrong. PAPP, pregnancy associated plasma protein, is not a part of quadruple. Instead of that, it should be HCG. HCG, alpha fetoprotein, inhibin A, and unconjugated estradiol is a part of quadruple test in pregnancy. So you won't be able to score, unfortunately, for this round. We will move to Meconium Masters. Are they ready? Meconium Masters, just say hello. Yeah, okay.
Are we audible?
Yes, you are audible. You are audible.
Okay, thank you.
Okay, so the first question for you. A couple has a history of 2 male babies died in the first week of life. There were 1 healthy female child who is 3 years old. In the last baby had been investigated and found to have a severe hyperammonemia. Which one of the following condition is most likely? Isovaleric acidemia, medium chain acyl coenzyme dehydrogenase deficiency, ornithine transcarbamylase deficiency, or maple syrup urine disease. You are running out of time.
The answer is 2.
Wrong. That was wrong. The answer is 3. Correct answer is a OTC deficiency. So unfortunately, we can't score you for this one as well. It's a male child. 2 male child babies have died. So you have to think like that way. And there is a hyperammonemia, severe hyperammonemia. So again, the next question is for Meconium Masters. You are ready?
Yes.
Which one of the following is not a normal newborn variant? Erythema of the umbilical skin extending onto abdomen. They produce breast milk, have a single palmar crease, and have a subconjunctival hemorrhage. Time starts now. Sorry?
My answer is 1.
Yes, that's a correct answer. So we will get 10 points for that. That's good. So that will conclude your round for Meconium Masters. So the next team, Hyperbil Heroes, should be ready. Are they ready?
Yes, sir.
The first question for you. Maximum oxygen saturation is there in which of the following blood vessel in fetus? Ascending aorta, descending aorta, inferior vena cava, and ductus venosus. Sorry, this is not going well.
4.
Which one?
Our answer is 4. Ductus venosus.
That's a correct answer. Ductus venosus has the highest number of oxygen saturation out of all these vessels. So we can give 10 points for this. Okay, can we move on to the Dr. Kronal? Please score them 10 for this.
Yes,
question.
sir. I would score.
Yes. So the next question is for Hyperbil Heroes. Commonest cause of congenital hypothyroidism: A, 1 thyroid dysgenesis, 2 maternal drugs, 3 TRH deficiency, 4 is iodine deficiency.
First answer.
First is a correct answer. That is a thyroid dysgenesis. So you will get 20 points for this round. Very well done. So the next question is to the precious Preemies.
Yes. Yes, sir.
You're ready?
Yes, sir.
Okay. When does colostrum production start? First trimester, number 2, second trimester, number 3, third trimester, or number 4 is after birth of baby?
Third trimester.
Sorry?
3.
Just say number.
3.
3 is a wrong answer. The colostrum production starts in the second trimester of the pregnancy. So you won't be able to score marks for this question. The next question for precious Preemies. Maternal uniparental disomy is seen in which of the following condition? 1. Angelman syndrome, 2. Prader-Willi syndrome, 3. Lauren-Moon-Biddle syndrome, and 4th is a Fragile X syndrome.
Angelman. Answer A, 1.
Angelman. Angelman is a wrong answer. It is a Prader-Willi syndrome. This is a maternal uniparental disomy. So both the things are coming from mother only. So that is a loss of paternal chromosome. That is a Prader-Willi syndrome. So the right answer, maternal uniparental disomy, is a Prader-Willi syndrome. So precious Preemies, we won't be able to give you marks for this question. I think that will conclude our round 1. All the 4 teams have answered 2 questions. So we will, before we move on to number 2 round, Dr. Krunal can briefly give us the score, and I will invite Dr. Anuj to take on with the second round.
I'll share the screen.
Yeah, shall I unscreen?
Yes, sir.
You share?
Yes. Can you see the screen?
Not yet.
Now, sir, can you see the screen?
Yes.
Yeah. Round 1 score: Premature Panthers 0, Meconium Masters 10, Hyperbil Heroes 20, and Precious Preemies 0. This is the score at the end of the round 1. Okay.
So Krunal, if you unscreen, I will share my screen.
Yes, sir. Yes, yeah.
Right, thanks, Jatin. We'll move on to the round 2 now. The first question will be for the Premature Panthers.
अभी आएगा.
Are you able to see?
Yes, sir.
Yes, sir.
This is last one.
Okay, starting round 2. First question for Premature Panthers. Propranolol is used in all conditions as below except 1. SVT, 2. Large hemangioma, 3. Congenital heart block, 4th. Tetralogy of palate. Your time begins now.
बीटा ब्लॉकर यूज करते हैं. हार्ट ब्लॉक में बीटा ब्लॉकर यूज करते हैं. लार्ज में करते हैं सर. हेमेंजियोमा सर 3.
Okay, 3 is the correct answer. Congenital heart block. You were just on dot on time. I would be more strict with time next time around. Okay.
Yes, okay. Yes, sir.
So please make sure you give your answer in time. All the teams.
Yes, sir.
Okay. Second question. So Krunal bhai, can you give 10 marks to Premature Panthers, please?
Yes, sir.
Second question for Premature Panthers. Out of all the neurological criteria in the new Ballard scoring, which one has got a maximum score of 5? 1. Posture, 2. Arm recoil, 3. Popliteal angle, 4. Scarf side. So the time starts now.
Sir, 1.
Okay, that's the wrong answer. The correct answer is number 3, popliteal angle. That's got a 5 score.
Okay, sir.
So no points to Premature Panthers for this question.
Yes, sir.
Round 2, next question is from Meconium Masters. You ready? Meconium Masters, you ready? Enzyme is deficient in patients with Gilbert syndrome. 1, bilirubin hydrogenase. 2, bilirubin oxidase. 3, biliverdin reductase. And 4, glucuronide transferase. Your time starts now.
My answer is 4.
Okay, 4, glucuronide transferase is the correct answer. 10 points to the Meconium Masters for that. Okay, round 2, second question for Meconium Masters. Of the following well-known randomized controlled trials, kindly mention which RCT was prematurely stopped due to adverse outcome in one of the arms. 1, Boost 2 trial. 2, Support trial. 3, the Rainbow trial. And 4, the PIPS trial. Time starts now.
Support तो थे जो officially failure exam
My answer is 3. Rainbow trial.
Okay, that's the wrong answer, unfortunately. Boost 2 trial was prematurely stopped. So the correct answer is number 1, Boost 2 trial. So no marks for Meconium Masters for this question. Okay, the next question is for Hyperbil Heroes. Are you ready?
Yes, sir.
So the most common timing of seizure activity in infant with HI is 1, 0 to 6 hours of life. 2, within 24 hours of life. 3, 24 to 48 hours of life. 4, greater than 72 hours of life.
Answer 2.
Okay, 2 is the correct answer within first 24 hours of life. So 10 points to Hyperbil Heroes for that. Second question for Hyperbil Heroes. What correctly describes the Barlow maneuver? In supine straightening, both the lower limbs, affected side appears shorter. 2, on flexing the infant's knees, feet touch the surface and ankles should touch the buttock and check for the level of knees. 3, femoral head dislocates as the hip is flexed, adducted and pushed posteriorly. 4, femoral head is relocated when the thigh is abducted.
Answer 4.
Unfortunately, that is incorrect. It's number 3. Femoral head is dislocated when you flex and adduct and push it posteriorly. Barlow में बाहर आता है. Otolani में reverse होता है. Okay, so no points to Hyperbil Heroes for this question. Precocious Preemies, are you ready for your round?
Yes, sir.
The average amount of colostrum secreted in the first 24 hours after delivery is 1, 5 to 10 ml, 2, 15 to 30 ml, 3, 50 to 70 ml, 4, 100 to 120 ml.
Sir, answer is 1.
Okay, unfortunately that is incorrect. 15 to 30 ml, answer number 2 is the correct answer. So unfortunately no points to Precious Preemies. Precious Preemies, you ready for your second question?
Yes, sir.
According to NRP, below which gestational age plastic bag or wraps are recommended?
Answer is 4. 4.
Okay, that was very quick. Let me, even before I could give you the options, please give me the time to give options next time. So, but your answer is correct. 32 weeks, number 4 is correct. So 10 points to Precious Preemies for that question. So that brings us to the end of the round 2. Kunal bhai, if you can share the scores.
Kunal just speaks. Okay, fine. Kunal, unmute.
The round two scores are Premature Panthers have 10 points, Meconium Masters have 10 points, and Hyperbil Heroes have 10 points, and Precious Preemies have 10 points. All the teams have 10 points each.
Okay. So come on, all the teams, buck up, and best of luck for the third round. And Jatin sir will take the third round.
Okay, so we have just completed both the rounds which are MCQs. We are moving to some other rounds, number 3 and number 4 rounds. They don't have MCQ, you will have to speak answer for that. So in this round, this is a more of a radiology round. We will be asking questions based on images. Each question has 2 sub-questions in it. And each correct answer will give you 20 marks. So in one question, you can maximum score is 20 marks. Okay. And because of there are 2 questions, we have increased the time limit to 20 seconds. So we will go in the same sequence. We will start with the Premature Panthers. So if they are ready, I will just put the question on the screen. Are you ready?
Yes,
Yes, sir. Yes, sir.
Yes, sir.
Okay. So a full-term 3 kg baby required resuscitation at birth and had significant HI. Baby was started on therapeutic hypothermia. Number 1 question, identify the investigation. Number 2 question, please identify the pattern.
The first answer is AEEG.
Sorry?
AEEG.
AEG. Can you expand? A means?
Accentuated EEG.
That's not right. Number 2 answer?
CMV.
CFM.
CFM pattern.
CFM is right answer. Number 2 you did not give. So this is an image of a cerebral
Burst
function.
suppression.
Yeah, burst suppression, but I'm unfortunately time is up. And AEG is an amplitude EEG.
Amplitude.
So you could not, either you would have said cerebral function monitor or amplitude EEG would have been the right answer. And this pattern is a burst suppression pattern. So you said CFM, cerebral function. So we can score 10 points for that, but we won't be able to give you marks for the pattern. So Krunal bhai, for this question, Premature Panther will get 10 marks.
Yes, sir.
Okay, the next question, Meconium Masters, you are ready? Hello, Meconium Masters?
Yes.
Okay. Yeah, we'll fire away. So, a term baby who is known to have a bilateral antenatal hydronephrosis underwent following investigation. There are 2 questions. Please identify the investigation and name the radiological sign.
It is ultrasound of KUB. That is the investigation.
That's correct answer. Number 2.
Radiological sign is dilated bladder with thinning of the cortex. So it would be a posterior urethral valve because there is a obstructive or it's filled with urine.
Yes, ma'am. What we have asked the question is a name the radiological sign. So this sign is known as a keyhole sign. This is a typical appearance of a key, and then there is a key. This is definitely posterior urethral valve. But the question was identifying the radiological sign. You rightly identified it is a KUB, so USG KUB. So first answer is right. Second, we can score for that. This is a radiology round. So we wanted you to tell us about that sign, which is a keyhole sign. Prashant bhai, 10 points to Meconium Masters for, Krunal bhai, 10 points to Meconium Master for this question. This is definitely PU1. So next, Hyperbil Heroes. Are you ready?
Yes, sir.
A baby born at term with a birth weight of 3.2 kg presents on day 1 of life with excessive oral secretion and poor feeding. You have to name the specific anomaly here, okay, correctly. And number 2 is, when can you suspect antenatally? What findings will you see in antenatal scans? Time starts now.
Anomaly is tracheoesophageal fistula. Antenatally.
That is wrong. That is not complete answer.
Esophageal atresia associated with tracheoesophageal fistula.
That is correct answer. Esophageal atresia. What did you say? Esophageal?
Atresia.
With TOF is not answer. There is no stomach bubble, so there is no fistula here. This is isolated esophageal atresia.
Type A of the esophageal.
Yes, this is a type A isolated esophageal atresia where you won't be able to see a stomach bubble. You can see the X-ray. There is a coiling of the Riles tube in the upper pouch, but there is no stomach bubble. So there are only 2 variants which can show there is a type A, which is a pure esophageal atresia, or there should be a proximal fistula. So the correct answer should be, if it is a proximal fistula, you would have said you will get esophageal atresia should be the right answer. So unfortunately, we can't score with the TOF. And the antenatal, you can suspect there is a polyhydramnios and absent stomach bubble. Both findings should be there to give you points. Then you can suspect this is a esophageal atresia. There should not be any stomach bubble. Okay. So no points, unfortunately, for you, Hyperbil Heroes. So the next question will go to Precious Preemies. Precious Preemies, you are ready?
Yes, sir.
Please identify the lesion in this image. What is the most likely outcome?
Sir, PVL.
That's correct.
And most likely outcome cerebral palsy.
Yes, that is also correct. Can you expand PVL? What is PVL?
Periventricular leukomalacia.
Okay. I think we can give you 20 marks for this question. So both answers were correct. Krunal bhai, Precious Preemies should get 20 for this.
Yes, sir.
So this was the radiology round where we had different images, different investigations and interpretation of that. We had 2 questions in each of them, and all of them answered very well. So let's get the score, and then we will move on to number 4 round.
Round 3 score is Premature Panthers have acquired 10 points, Meconium Masters 10 points, Hyperbil Heroes in the round 3 0, and Precious Preemies in the round 3 is 20.
Okay, so I will
total score also. Krunal, the total score.
Total score till now for Premature Panthers is 20, Meconium Masters is 30, Hyperbil Heroes is 30, and Precious Preemies are 30. So 3 teams are on 30, and and Premature Panthers is on 20.
That's
So
good going.
you have to be ready with tiebreaker. I think they are going head to head.
I think let's see how we go with the rapid fire will be decided. We might have we have a very interesting round. Next one, Dr. Anuj is going to talk about, which is some new addition compared to last quiz. So I will hand over to Dr. Anuj for that.
And last time also in rapid fire round, people had changed.
Yeah, I think all the teams are going neck and neck. So it is exciting to see but yeah, as Jatin said, the tiebreaker round will be crucial. But this 4th round is a different round from last year. Last year we had some echo images. So this time we have something unique, something different. Premature Panthers, are you ready for your question?
Yes, sir.
So in this round, in this round, there will be 2 questions per team, and it's pulmonary graphics, and each correct answer will give you 10 marks. Okay. So pulmonary graphics, I hope every one of them you is using them, and 20 seconds allocated to each of you for each question. Okay. Premature Panthers, you ready to go?
Yes,
Yes,
sir.
sir.
Okay. So name this graph. So there are 3 types of pulmonary graphics, if you know. And among them, this is called a scalar. But which type of scalar is this? I wanted to know.
नहीं बोला.
I couldn't hear any answer. So this is a flow time scalar. As the time goes, the flow, when the inspiration happens, this flow goes up, and during the expiration, the flow goes down. Okay, so this is a flow time scalar. Okay, so no points to Premature Panthers for this one. You ready for your next question, Premature Panthers?
Yes, sir.
Okay, so what does the highlighted area indicate? So this is the highlighted area in the circle. What does that indicate? So this is a pressure, volume pressure loop. Okay, in that, what does that highlighted area indicate?
Tidal volume.
Is that your answer?
Yes, sir.
Okay. Unfortunately, that's incorrect. So
Press it.
this is showing the air leak actually. So
Oh,
during the
okay.
this goes up, and during expiration, so there is a difference in the volume between the inspiration and expiration. That means there is a air leak. Okay. So unfortunately, no points to Premature Panthers for this round. Meconium Masters, are you ready for your questions?
Yes.
So on a pressure time scalar, what does the point A, what does that signify? You can see the pressure time scalar, A, B, C points are written. What does the start point A signify?
It's a starting of the inspiration.
Okay, I'll take that as correct. It's the trigger or the starting of the inspiration that is seen in the point A. Okay, so 10 points to Meconium Masters for that. Your second question. Can you tell me the cause of the highlighted pattern? So you can see this is highlighted. So
Air trapping.
Okay, air trapping is the correct answer. So, well done, Meconium Masters. You got 20 out of 20 on this round, so very well done. Hyperbil Heroes, are you ready?
Yes, sir.
Okay. So identify this graph.
Pressure volume graph.
Okay, that's the correct answer. So 10 points to Hyperbil Heroes for that. You ready for the second question? And what is the cause of the highlighted pattern in the graph? So you can see there's a circle there. What is the cause for that?
Drop in inspiratory flow.
Sorry?
Drop in inspiratory flow.
The drop is inspiratory flow is there, but the reason for that is what we wanted. So unfortunately, no points to you for this one. The reason is a short eye time. So you have the inspiratory flow, and then it suddenly gets abrupted and you go into expiration because the set inspiratory time is too short. Before the baby can complete his inspiration, the expiration is starting. So the correct answer is short inspiratory time. So no points to you for this question, but you had the points for the first question. Okay. Precious Preemies, are you ready for your question?
Yes, sir.
Okay. What is the highlighted area known as?
Functional residual capacity.
Okay. Correct, absolutely correct answer. 10 points to Precious Preemies for that answer. Very well done. And the second question for you, precious Preemies. Identify the pattern highlighted. What is specifically being shown in that highlighted area?
Peak.
Sorry?
Auto trigger.
Is that your final answer?
Yes.
Okay, that's incorrect. This is showing beaking, which is
Beaking.
showing that you are giving too much pressure. As you're increasing the pressure, the volume is not going up. Okay, so that means you need to reduce your peak inspiratory pressure. Okay, so no points to you for the second question, but your first question was correct. So that brings us to the end of round 4. Kunal bhai,
Yeah.
you can share the scores, please.
Yeah, round 4, Premature Panthers 0, Meconium Masters 20, Hyperbil Heroes 10, Precious Preemies 10. So, and the total score of Premature Panthers at the round of 4 is 20. The team has to buck up. Meconium Masters is 50. They are doing good job. Hyperbil Heroes is 40 and Precious Preemies is 40. So 2 teams on 40, 1 on 50 and 1 on 20.
Right then. So some variations now from the last. So this will bring us to the decider round, which is number 5 rounds. This is a tiebreaker round. Rapid fire round. Now there are 10 questions which you will have to answer in 1 minute. Okay. The maximum you can answer, the maximum you will score. For one question, you will get 10 marks. If you answer all 10 correct, you will get 100 marks. Okay. If you don't know the answer, without wasting time, you can just say pass, so that we will immediately go to the next question. So be quick and answer as many as you can, and you can completely change the table at the end of the round. So, Prashant bhai, would you be able to run this round?
Yes. You can just stop screen sharing so I can run.
Yes, I will stop and Dr. Prashant will lead this.
So I think the screen is visible full. Everybody?
Yes, sir.
So this
Yes, sir.
is your most precious round because you are going to score 100, and the time your game is most vulnerable when you are ahead, never let up. So this is for the teams who are ahead. And I think, as Jatin bhai already said, there are 10 questions in 1 minute. If you don't know, just say pass so that you can get all 10 questions and many can be answered. So the Premature Panthers, are you ready?
Yes, sir.
And Prashant bhai, just be quick in speaking so that
Yeah, definitely.
So that we don't.
Premature Panthers, for you, your round starts now. First question: when is KMC Awareness Day?
Pass.
Nerve root involved in clump-case paralysis.
Pass.
Name the drug which can cause IHPS.
Erythromycin.
Cumulative dose of dexamethasone in DART.
Cumulative.
24.
Which type of immunoglobulin is highest in breast milk?
IgA.
Please expand exit procedure.
Pass.
Radiological sign in partial anomalous pulmonary return.
Pass.
Cardiac output is equal to blank into heart rate.
Stroke volume.
Perfect. So out of 8, you attempted 8. Out of that, you've given an answer 3 correctly. So the KMC Awareness Day is celebrated on 15th of May. Nerve root involved is C8 to T1. Drug, you said correctly, erythromycin. Cumulative dose of dexamethasone is 0.89 milligram per kg. It is a cumulative dose. Then which type of immunoglobulin? Correctly said IgA. Exit procedure is ex utero intrapartum treatment. Radiological sign is Kimmeter's sign, and cardiac output correct. Stroke volume into heart rate. So Kunal, they have given 3 correct answers: erythromycin, IgA, and stroke volume.
30 points.
30 points, right?
Yeah.
Prashant, we can show other two to audience as well.
એ ઓડિયન્સ માટે જતીનભાઈ મેં એવું કર્યું કે
એટલે
આપણે
ખાલી
કદાચ
બતાવી
ટાઈ
દો.
બ્રેકરમાં જરૂર પડે તો
Fine, fine. Okay, okay.
એટલા માટે નથી બતાવી રહ્યો કે ટાઈ બ્રેકર માટે જરૂર પડે તો એ વાપરી લઈશ.
You are
ફાઇન. Meconium Masters. Ready?
Yes.
Screen is visible?
Yes.
Yeah. So your time starts now with this question. Yeah. Which week is celebrated as World Antimicrobial Awareness Week? What is the inheritance of hereditary spherocytosis? Hello?
Autosomal dominant.
Correct. Expand Trali.
Transfusion related lung injury.
Correct. Mechanism explains gas exchange between adjacent lung units with difference time constant on HFOV. Be quick.
Pass.
What does Bell stage 3A refers to?
NEC, staging of necrotizing enterocolitis.
Okay. Galactosomia is contrary to breastfeeding. True or false?
False.
False. So you're given first answer antimicrobial week is 18 to 24th November, which was not given. Autosomal dominant is a correct answer for your inheritance of hereditary spherocytosis. Transfusion related acute lung injury is correct. Mechanism of gas exchange you have not answered, that is a pendulum effect. What does Bell stage? You said severe NEC or what you said? NEC?
Yes.
3A?
Staging of necrotizing enterocolitis.
No, that is there, but we have asked that Bell stage 3A refers to.
So we have to be very specific as to what you are, which stage refers to what stage in the NEC. Obviously, Bell staging
So
is
3A is severe NEC with intake bowel and 3B is, yeah. And galactosemia, you said galactosemia is contraindicated to breastfeeding, false, but it is a true. Galactosemia is a contraindication to BA. So, Kunal, two right answers, right?
Yeah.
Jatin bhai?
yes,
Yes.
two. Yeah, true.
Yeah. Two right answers.
Number 2 and number 3 were right.
Yeah. So sorry, you have given actually an NEC answer correctly, but then it was a staging. So
We
you
asked very
correct answer.
specific 3A. We wanted
Yeah.
to put that information 3A. So that was the crime.
Hyperbil Heroes, are you ready?
Yes, sir.
Yes, sir. Screen is visible?
Yes, sir. Yes, sir.
Okay. Your time starts now. Please expand A and TT, infection control related.
Pass.
Most common CP type after cardiac truss.
Spastic CP.
Most common type of tumor in neonates.
Pass.
Which cardiac anomaly can occur if mother is on lithium?
Epstein anomaly.
Thiamine is used as treatment in which inborn error of metabolism?
Pass.
During neonatal resuscitation, what should be the FiO2 delivered during chest compression?
100%.
Where is surfactant produced in lung?
Type 2 pneumocystis.
Type 2?
Pneumocystis.
Noonan syndrome inheritance.
Pass.
Hoffman technique used for?
Pass.
Pass. So it's finished. I mean, the time is over. You're not expanded ANTT, that is aseptic non-touch technique. Most common CP type after cardiac arrest is chorioathetoid. So that was wrong. Most common type of tumor in neonate is teratoma. Mother on lithium, you answered?
Yeah,
Epstein. So that is correct. Then thiamine is used in treatment of which disorder? You have passed it, right? But it is MSUD or lactic acidosis. Neonatal resuscitation, FiO2 is 100%. That is correct. Surfactant produced type 2 pneumocytes. That is again correct. 3. Noonan, you pass. So 3 correct answers, 30 points to them. Kral.
Yeah, 30 points.
Yeah. And now the precious Preemies. Are you ready?
Yes, sir. Yes, sir.
Yeah. And is my screen visible to you?
Yes, sir.
Yeah. So now starts your time. Expand my acronym, National Health Program.
Pass.
How early the Moro's reflex can be elicited?
28 to 28 weeks.
Correct. Most common congenital heart disease in Down syndrome.
Endocardial defect.
Correct. Which immunoglobulin is found maximum in breast milk?
IgA.
Mechanism of action of Milinon.
Selective dilation of pulmonary arteries, pulmonary vasodilation.
Mechanism of action.
Inodilator it is. Selective dilation. Pass.
Mousy order urine seen in.
Phenylketonuria.
Okay. Rate of calcium accretion in intrauterine period.
Pass.
Drug used in Premature trial.
Pass.
Recommended pre-ductal saturation at 3 minutes.
80 to 85%.
Wrong. Mode of ventilation proven to be beneficial in reducing BPD.
Volume control.
Okay, fine. So I think, see, you have not answered my acronym, that is mother absolute affection. Early Moro reflex, you said correctly, that is 28 weeks. Then most common congenital heart disease, you said EVS also correct. Then which immunoglobulin is found maximum in breast milk? IgA, that is also correct. 3. Mechanism of action of Milinon, you are not given correctly. I mean,
Sir, inodilator, sir.
Yeah, vasodilator you said, but
Inodilator, sir.
Inodilator you said, but you not said typically the phosphodiesterase 3 inhibitor. Jatin bhai?
No, it is a phosphodiesterase 3 inhibitor.
Yeah, that is, we have asked mechanism of action. Okay. Mousy order you answered correctly. PKU, that is fine. Calcium, you have not answered, 80 to 120. Premature trial, you have not answered, that is hydrocortisone. Pre-ductal saturation, you answered wrongly, 70 to 75. And the last volume targeted was right answer. So you're given 1, 2, 3, 4, and 5 correct answers. 50 points to you.
Yes.
See, the good thing is you attended all 10. So that is what was expected. That if you attend all 10, then you will be having good. So Kunal, now you can share the screen.
Yes, I'll share the screen.
I hope everybody enjoyed. I mean, these questions are made, I mean, such a way by Jatin bhai that everything is covered. So Kunal?
Yeah, I'm sharing the screen.
Jatin bhai, I will need to make a question book also.
Yeah.
We will help you out.
Definitely, madam. Result आई क्यों?
Yes.
Okay, Kunal bhai, Prashant bhai, announce कर दो.
Yeah, Kunal bhai.
Premature Panthers total score is 50. Meconium Masters total score is 70. They have tied up with Hyperbil Heroes on 70, and the winner is Precious Preemies on 90. They won because of the rapid fire round.
Thank you, sir. Thank you, sir.
That is very good.
And the main thing is they have attended 10 questions fully. That was the reason.
Thank you, sir. Thank you, sir.
So congratulations to Jaimin and Animesh. Yeah.
Thank you, sir. Thank you, sir.
And Kunal, can you please unshare?
Yeah.
I hope everybody enjoyed and learned something new. I mean, I learned many things. And it happens that due to time constraints, sometimes we are not able to answer. So on behalf of NNF Gujarat, we thank all 4 participating teams that you participated in this. And special congratulations to Precious Preemies that you attended all 4. And then that was the changer actually. That otherwise all 3 were on same points. Meconium Masters were leading till round 4, and the tiebreaker was a changer. So thank you to Jatin bhai and Anuj bhai for conducting the quiz, and thank you to Kunal for being a particular scorer of the thing. I mean, and thank you to all the participants. Next Wednesday we are not having Neonatology Pathshala due to a festival, and after that we will be having meeting again in a Neonatology Pathshala, and we will be having again a round of this very soon. So encourage your colleagues to participate, and this will be a real fun. Once again, thank you to one and all. Deblina, we can stop the meet. Yeah. Thank you.
Thank you, sir.